Greater Manchester young people's mental health and emotional well-being. It's time to be seen and heard. Over 100,000 young people in Greater Manchester need help with mental health. That's 1 in 10 young people in the region. Greater Manchester and Eastern Cheshire Strategic Clinical Networks is part of the Greater Manchester Health and Social Care Partnership. And young people's mental health is our priority. We know the best results happen when we work hand in hand with young people and their families as partners in care. That's why we pledged that now is the time for young people's mental health to be seen and heard.
I wish someone had helped me before things got so difficult.
We know early intervention gives the best results, so we'll promote awareness, prevention and early intervention by supporting programmes for all families.
I never saw the same person twice. Sometimes I didn't know whether I was coming or going.
Only 1 in 4 young people with mental health needs get access to the right support. It's time we connected the disconnected system by working as one partnership.
I just want to feel like I'm being listened to.
We'll make sure young people have a voice individually and collectively, and we'll put young people at the heart of decision making.
I hope other people will be able to learn from my experiences.
By collecting data, we've been able to set standards, such as access and wait times for early intervention in some conditions, so that young people and families get help earlier and more easily, close to home.
When I reached 18, it felt like I wasn't getting the same kind of support and had to start all over from the beginning.
We recognise that the majority of mental health issues in adulthood start before you reach 18. That's why we'll strive to deliver a seamless service whatever your age, so there's no reason to feel you're being treated differently.
Nobody understood all the different things I was going through.
Many young people with long-term physical conditions also need support with mental health and emotional well-being. The devolution of healthcare decision-making and budgets to Greater Manchester gives us an opportunity to build a whole system that looks after the whole person and whole family. All this brings us to the Future in Mind report. The report details the impact of issues with mental well-being in early years and sets out a blueprint for how to work together to address these. Working with partners across all sectors to deliver the right services in the right place at the right time to meet the needs of children and young people. We'll develop a local plan for each of our 10 localities, but with a joined-up strategy from prevention to prescription. With more money being invested in young people's mental health, we're working together to no longer be a Cinderella service, but a princess service. We all have an amazing opportunity to put child and adolescent mental health services on the map and make sure our young people are seen and heard.